Hello there. Nice to meet you. Yes, my name is Dr. Oliver, and welcome to the Ozone Eye Clinic. I was the one you spoke to on the phone earlier today. Yes, that's me. It sounds like we're just booked in for a general assessment for our eyes. Yes, just after an annual checkup. Make sure that eyesight is working correctly, including our visual acuity, etc. I see. Well, following our phone conversation, I did have a bit of a think, and in my professional opinion, I think it would be highly recommended that in addition to your general eye examination tests, we perform some other routine tests, mainly some eye reflexes, as well as tests for our extraocular muscles, or our eye muscles that sit around this area. Yeah, I think it's just important since you haven't been checked in a few years. So, before we begin, I just wanted to gather some extra history. If you don't mind, I've got my little notepad to the side. I just want to make sure that you've got no astigmatism. Yes. Okay, no to that. Excellent. Any diabetic reticulopathy, rather. Sorry, diabetic reticulopathy? No. No. Excellent, just checking those boxes. And lastly, any glaucoma? No. Okay. Perfect. And again, it's been roughly several years since we last touched base. Well, I will be explaining the processes in more detail as we get to each individual test. However, straight out the gate, I just wanted to provide some reassurance and let you know that today's procedures and examinations will not involve any harmful, painful, or invasive stimuli or tests. Additionally, please do not hesitate to communicate to me if you feel uncomfortable, anxious, or you are uncertain about what we will be doing. Yes, please do not hesitate to let me know. I am happy to accommodate and change my examination technique to suit you more appropriately. Does that sound okay? Excellent. Additionally, as a trained physician, I have undertaken a Hippocratic oath to my patients that I will perform no harm or do no harm to my patients. And I do not intend on breaking that Hippocratic oath at all throughout today's session. So, I'd just like you to join me in my office. Now, I realize it's a bit dark than what you might be expecting. I apologize. I did just recently have a patient who was quite photosensitive. In other words, they were extremely sensitive to some sources of light. And it's been a very busy day in the clinic. So as a result, I have had to leave this stuff up and haven't been able to rearrange the room. I hope that's okay with you. Okay, that's good. Yeah, you can think of it like a little bit of mood lighting, exactly. That's a good way to put it. So, we shall actually begin today's exam with a general inspection of your eyes. Now, I have myself some measuring tape here, and we are just going to be measuring the diameter of your pupils in each eye. So we'll start with your left. If you could just please look ahead. This is going to be a recurring theme, looking straight ahead. I just want to measure your pupils and their diameter. So hang out where you are there. Okay, that's good. Now, we are in an adult. We are looking for roughly a diameter between 2 and 4 millimeters in bright light. Yep, we'll just do the other one now, other eye now. Staying still, please. Yep. And in the dark, we're looking at roughly 4 to 8 millimeters in diameter. So we're in a light environment relatively, and your eye's diameter, or pupil diameter, is within working order. I'll just put my gloves on here now because we'll be doing some palpation or feeling of the eye area. While I'm doing this, would you just like to go ahead and let me know if you've had any eye strains or blurry vision, double vision, headaches, anything abnormal that you might be experiencing? None so far. Okay. Yeah, okay. You're 100% sure that you have not experienced any of those symptoms or signs. Okay, that's good. Excellent. Well, we will now be looking at your eyes. I just want to establish whether there is any ptosis or asymmetry in our eyelid positioning rather. So just hold still, and again, looking forward. Pardon me. Looking forward for me. Okay. Just having a nice close look there. So that appears to be all okay. Nothing abnormal detected between your left and right eyelids. Yes, NAD, as we like to say in the medical term. No abnormalities or nil abnormalities detected. So that's good. Give your eyes a bit of a rest there. Next, we shall be checking what's called our 6 cardinal fields of gaze. Our 6 cardinal fields of gaze. These are dictated by 7 extraocular muscles, or eye muscles, just a fancy term for eye muscles really. And these 6 cardinal fields of gaze are essentially looking up, looking down, looking side to side, as well as diagonal movement. Yeah, quite straightforward, exactly. And these 7 extraocular muscles, or eye muscles, they are our medial and lateral rectus, our superior and inferior rectus, our superior and inferior oblique, as well as our levator palpebrae superioris. Our levator palpebrae superioris. These 7 muscles help perform those 6 cardinal fields of gaze. Now, we will be testing these fields of gaze. I want you to please look at the tip of my red pen here. And while keeping your head still, I want you to follow the tip of the pen with your gaze. So, starting here for me, that's it, and then out towards the side. Good. Out towards this side in a horizontal movement. Perfect. One more time. My right, your left. And then this way. Very good. Good, keep your head still. Now, vertical, up, down, or superior and inferior movement, as we say in the medical jargon. So superior movement, looking up, and then an inferior movement, or looking down. Superior or up, inferior or down. Perfect, that is good. Next, just a diagonal pattern, so looking in a diagonal movement. That's looking good, actually. Are you feeling okay? Excellent, and everything makes sense so far? Good. Yes, okay, that is good. Just continue to follow my pen. Very good. Excellent. Okay. Well, it appears those extraocular muscles are working fine because all 6 of those gaze fields or fields of gaze are working perfectly fine. Once again, nil abnormalities detected, NAD. I'll just jot that down in your chart. There we go. Yeah, just have a break. That's it. You're doing really well so far. Sorry, it's a bit hard to write with the gloves sometimes. Actually, that's a theory. Maybe that's why our handwriting, or doctor's handwriting, is so horrid. It's because we have to write with gloves a lot of the time. Just my theory. Anyway, let's move on. We're going to be doing some eye reflex tests. So we will start with an eye reflex test known as a vestibulo-ocular reflex. Just a fancy term for ensuring that we can maintain our gaze while moving our head. So during head movement, can we maintain our gaze? Exactly. So once again, with my trusty red pen, I want you to look at the tip of the pen and move your head left, right, while still maintaining your gaze. Yeah. So looking to your left. Good. And then the other way for me, please. Just like that. Don't mind me. Just observing your eyes. Okay, keep going, please. Good. And then looking up towards the ceiling, still maintaining that gaze. Okay, that's good. And then looking down towards the ground. Very good. Very good. Okay. Right. So our VOR reflex, or vestibulo-ocular reflex, is all fine. Next, I want to check your smooth pursuit, essentially being able to follow an object or item smoothly with your eyes. Very important for when we're looking at a billboard or reading something. Our eyes smoothly travel in a line. That is where this smooth pursuit eye reflex comes in handy. So, also part of cranial nerve testing, but that's for another day. Let's look now at this pen moving towards this horizontal pattern. Good. Good. Yep, so you're moving your eyes with this one. Yep, your head's still focusing on a point in front of you, potentially my nose or behind me. Keep doing that. Very good. Okay, so that is all smiles for our smooth pursuit function. I'll just write that one down in my notebook. Excellent. Right. Brings us to our next eye reflex, saccades. S-A-C-C-A-D-E-S, saccades. So, saccades allow you to move your eyes and dart them from position to position quite quickly. So another example would be, again, for with reading. When we're going down the page, we have to quickly adjust our eyes to look from one line to another as we go down the page. Does that make sense? Yeah, exactly. So it's jumping from point to point with our eyes. Accurately is the key word here. So I'm going to move the pen, and I want you to fixate your gaze to the pen as quickly and as precisely and as accurately as you can. Does that make sense? Okay, perfect. Well, starting here, now out here, 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 up in the corner, back here, to the side, here. Excellent. And finally, from one finger to the other finger. Very good. Very well done. Yes, have a seat there. Have a bit of a breather. We're doing really well so far. So no issues at the moment. So once again, that little test in particular was for our saccades. Okay, very good. Well, next we have what I'm sure you are very familiar with, our little eye chart here, or our Snellen chart as it is called. Yes, our Snellen chart. So we are testing with this our visual acuity. Our visual acuity is essentially our ability to discern shapes and what we see with our eyes. There are many different factors that go into visual acuity, such as depth perception, peripheral testing, and color. However, we will be testing some of those next. But for now, let's test our acuity with this Snellen chart. S-N-E-L-L-E-N, Snellen. So, essentially, I'll be pointing to a line, and I would like you to, as accurately and precisely, recite the letters on that line from left to right for me. Yeah, I will be standing just off to the side so as not to distract you. I am just here to record and direct you. Is that okay? And everything makes sense so far? Perfect. Glad we're on the same page. Anyway, let's start with the top line here. And then this line here. Good. This line. Very well done. This line now, please. Yes, if you could please speak up just a little bit. My hearing is a little bit, not the best. Yep, okay. And then the next line for me, please. Sorry, did you say P as in Peter or Z as in zebra? P as in Peter. Yeah, okay. Continue. Good. Next line. Okay, yep, getting a little bit trickier now. Yeah, that's okay. Keep going as best you can. Yeah. All right. Very well done. And the last line here. Yep. Dunskies. Very well done. So normally I would have stopped you if you got more than 50% of the letters on a specific line wrong or incorrect. However, I did not stop you, so you've passed with flying colours. You might be wondering, what do your test results mean? So 20/20 vision essentially means that you can see something from 20 feet away that you should be able to see from 20 feet away. If you had better vision than that, such as 20/40 or 20/40 vision, that means you would be able to see something from 20 feet away that other people with 20/20 vision would only be able to see from 40 feet away. And then on the other side, the other end of the spectrum would be 20/200, which essentially would mean you'd be only able to see this letter up here from, which should be able to be seen from 200 feet away. If you had 20/200 vision, you would only be able to see this from 20 feet away versus 200 feet away, which is what someone with 20/20 vision would be able to see the letter from. I know that's a little bit confusing. I hope I didn't jumble your brain too much there, but let's move on. Moral of the story, you have normal vision. Oh, and if you're ever in somewhere where they use meters, such as Australia, then it would be 6/6 vision. The exchange from feet to meters would be 6 meters versus 20 feet. Yeah, exactly. Bit of a exchange there in imperial and metric systems. Okay, now let's test your depth perception. So I want you to focus on the tip of this pen for me, and then with your finger I would like you to place roughly 6 inches or about 15 centimeters in front of your face, but still in line with this pen. So like that. Yeah, that sort of setup. Perfect. Yeah, just like that. Doesn't matter which finger. So now I want you to focus your gaze on the tip of this pen. Excellent. Now, as you focus your gaze there, sorry, I'll just scoot out the way. As you focus your gaze there, you should be able to see a faint outline or silhouette or copy of 2 of your fingers either side of the pen. Good. Excellent. And then when you start to refocus on your finger that's in front of you, you should notice that the pen now is almost like 2 copies, 2 mirror images either side of your finger. Good. And as you snap back to the tip of the pen and your finger, does that still happen? That miraging sort of effect, per se. Good. Okay. And that is an indicator of good depth perception, which, again, is nothing abnormal detected in your case. I'll just jot that down. Always have to record these things. Perfect. So we're almost finished with our test. Next thing we're going to be doing is with our light. So we're just going to be looking at our pupillary light reflex. Now, when a light is exposed to your eyes, we have a constricting effect, which the pupils do, and this is called our pupillary light reflex. Quite normal, and can be, if it's absent, indicative of some quite serious pathology or conditions, or brain injury potentially. So let's test this out. I'll get you to, once again, look behind me or focus on my nose or some sort of point. Okay, I'll just come in nice and close because I do want to see your pupils here with the light. It should be nice and faint. This is good. This is good. Alrighty there. There we go. There we go. So that left pupil is dilating rather quite well. Good. As we established before, 2 to 4 millimeters is normal in bright light. That's what we're getting at there. And then 4 to 8 in dark scenarios. Let's try your right side. It's good. Alrighty. So once more, just trying again on that left side. Very good, very well done indeed. Okay, good, you're doing well. Keep focusing straight ahead for me. Perfect. Excellent. You're doing very well there. Ooh, turn that one off. Now the last test we will do is for your peripheral vision. So again, focusing ahead, either on my nose or some point behind me with this red pen. I'm going to be moving it to the side, and I would like you to let me know as soon as you can no longer see the pen in your peripheral vision. So we'll start in the center here, again, looking at my nose or some point, and then out towards the side. Tell me when. So yeah, just about there. Alright, now bring it back into your field of view. Can you see it? Good. And then moving it out once more for me. When? Yep, about there. Okay, good. Let's try your other side. When? Yep, there. Okay. And then one more. When? About there. Okay, and you can still see it there now. Very good. Excellent. Well, you will be very pleased to hear that all of your eye tests, including your extraocular eye muscles that we listed, your visual acuity, including your depth perception, visual fields and peripheral vision, they are all in working order, and I can tick, tick, tick on everything in your chart. In fact, let's go ahead and do that now. I'll just sign off on that. Dr. Oliver with a flourish. That's good. Very nice. Very good. So, I would recommend booking for an appointment in roughly 1 year's time. However, if you do notice any changes such as headaches, blurry vision, or you notice your eyes straining, particularly when you read or drive, then please don't hesitate to call up the Ozone Eye Clinic again and book in for an appointment immediately. Yeah, it's not just me working here. We have Dr. Bonacorsi, we have Dr. Fresta, we have Dr. Blake, we have Dr. Jenner, we also have Dr. Hones as well. Yeah, there's a fair few doctors around that are very capable and qualified individuals, not just me. Yeah. Okay, so for now, I'll let you have a chat to our receptionist, Barbara. Please make sure you sanitize your hands on the way out. Thank you for coming in, and I hope you have a wonderful day. If you enjoyed this roleplay, I would really appreciate it if you left a like down below, and if you really appreciated it, clicking the subscribe button for more ASMR content. Enjoy the rest of your day.